The full body movement that I chose was bowling. The step phase is initiated when your non-dominant foot, in this case my left, takes a step forward and begins the entire movement. There are usually 2 hands on the bowling ball during the step phase. I hold the ball at my chest, but some hold the ball by their dominant hip. The push phase begins when the non-dominant foot heel strikes the ground and the dominant foot begins the pre-swing phase. As the dominant foot is in the swing phase, the ball is being pushed upward and forward to the side of the bowling arm of the individual. Midway through the push phase, the non-dominant hand releases from the ball. When the dominant arm is fully extended with the ball in hand, the dominant foot should be heel striking the ground. The loading phase begins with the descent of the bowling ball and consists of the wind-up, or backswing of the movement. During this phase, the bowler takes the number of steps needed to advance towards the alley. The unloading phase starts once the ball reaches the end range of the backswing. As the ball comes from behind the bowler and nears the hip, the dominant leg moves out of the way and slides behind the non-dominant foot or the plant foot. The release phase is the point in which the ball is released from the hand. The follow-through is the conclusion of this phase. The osteokinematic movements for this phase is the left ankle is in dorsiflexion. The right ankle goes from neutral to dorsiflexion, right there. Along with that, the left ankle, in order to get into dorsiflexion, has a posterior talar glide, an anterior tibial and fibular glide. The right ankle has a posterior talar glide and an anterior tibial and fibular glide as well. The osteokinematics for the knees are as follows. The left knee is in flexion, and the right knee is also in flexion. However, it goes from flexion to or towards extension, as you can see here, with this movement phase. The arthrokinematic movements that go with this is the left knee, the femur anteriorly glides and externally rotates, the tibia posterior glides and internally rotates, and the right knee, the femur posteriorly glides and internally rotates. The tibia anteriorly glides and externally rotates. The left hip is in flexion and adduction. With this comes the left hip arthrokinematics of having the coxofemoral joint glide posterior and inferior and also superiorly with adduction. The right hip is currently in a position of going from extension to flexion, and is also being adducted. With this comes gliding from anterior superior to posterior inferior, and with adduction it is gliding superiorly. Due to the step forward, my pelvis is currently in an anterior tilt, The arthrokinematic movement that goes with this is counter nutation. The C-spine is in left lateral flexion, and during this, the arthrokinematic movements are compression of the left zygapophyseal joints and distraction of the right zygapophyseal joints. My right GH joint is in a position of flexion, abduction, and it goes from neutral to slight internal rotation as I release the ball. The arthrokinematic movements that go along with this is gliding posterior inferior, gliding inferior, and rolling anterior and gliding posterior. The left glenohumeral joint here is currently in internal rotation from anatomical neutral, is in a position of extension, and then goes from extension here to flexion there. The arthrokinematic movements that go along with this are rolling anterior and gliding posterior, gliding anterior superior, and then gliding posterior inferior. In this area, we have the scapulothoracic joint. The right scapulothoracic joint is in a position of posterior tipping and depression because the shoulder is in flexion, and the ST joint is in a position of upward rotation because the shoulder is abducted. With this come the right ST arthrokinematic movements of posterior inferior glide and lateral superior glide. The left ST joint is anterior tipping and then anterior tip and elevation to posterior tip and depression because it is going from a position of extension to flexion as I showed previously. The arthrokinematic movements that go along with these ST joint movements are anterior superior glide and then anterior superior glide to posterior inferior glide.